Okay, this is another section, mid-sagittal section, that's showing the inside of the nose. And this is a little bit different than the other one, not much, but it's showing, for example, here this is called the nasal septum. This is a cartilaginous part. It's hyaline cartilage. This is a cartilaginous part of the system, of the septum, the nasal septum. And this bone is called the perpendicular plate of ethmoid, meaning it's a plate that's coming perpendicularly from the ethmoid bone, which is this bone here. So perpendicular plate of ethmoid. This is called the vomer. And this is a maxillary bone, and this is part of the palatine bone. So again, the nasal septum, you have the cartilaginous septum, which is the hyaline cartilage. This is a perpendicular plate of ethmoid, and this is the vomer. This is part of the maxillary bone. This is part of the palatine bone. The rest is very similar. This is the hard palate, which is bone. This will be the soft palate, which is soft tissue, and this will be the uvula that's hanging down there. If you open this, you can see the same things as we talked about before. This will be the superior concha or concha. This is the middle concha, and this is the inferior. This will be superior meatus, middle meatus, inferior meatus. This is the nares, or the nasal entrance, nasal opening, and this will be the vestibule, this pouch here, and this will be the ventricle. And then you have these conchae or conchae and the meatuses. And in the back, you can see at this point here, this is the entrance for the auditory tube, also known as, auditory canal, also known as auditory tube, also known as eustachian tube, or pharyngotympanic tube. So this is the opening of the auditory tube, eustachian tube, pharyngotympanic tube. Otherwise, it's the same. This is the frontal sinus, this is the ethmoidal air cells, and this is the sphenoid sinus, and this is the nasopharyngeal tonsil, also known as pharyngeal tonsil, also known as adenoids. And one more difference here is if you remove the conchae, which you can do in this model, you cannot do it in the other model, you can actually see what we talked about when we mentioned the cribriform plate of ethmoid, through which the nasal fibers will go through. Here, as you can see it actually. These are the nasal fibers, and as you see, they are going through the cribriform plate of ethmoid to make the olfactory bulb, olfactory tract, and this together will be the olfactory nerve. This is the other part of the same large model, basically same thing, but just looks a little bit different because you removed the mucous membrane that was covering. They removed it to show you what's inside. This is the same thing: superior concha or concha, middle concha, inferior concha. This is a superior meatus, middle meatus, and inferior meatus down here. And otherwise, this is entrance to the nose, or the nares, external nares, nostril. This dilation here is the vestibule. This dilation here would be the ventricle. Same thing otherwise. This is the frontal sinus. This is the sphenoid sinus. These are the ethmoid air cells, contain the ethmoid sinus inside, but this is the ethmoid air cell, what we can see here. This is a cribriform plate of ethmoid right here, which is the same as the one over here, which is contain pores to allow the olfactory fibers to go through, leaving the nasal cavity, entering to the cranial cavity, which is up here. And this is a palate, which is the same as this. This is a hard palate. Here is a palate. This part of the palate contains the bone in here, so this is a hard palate. This part is soft palate, and this will be the uvula. The whole thing here, not just this part, the whole thing is uvula that's hanging in the back that can open and close. And when it closes, it will close so that the food in the mouth will not reflect and go to the nose up. It's open and close, which is the uvula. So this part here is the hard palate, soft palate, and this is the uvula. This tonsil here is the tonsil under the palate. It's showing part of it, but it's good to know. And this is actually the typical lobular structure of any gland. It looks like lobule, another lobule, another lobule. Anytime you see something looks like this, lobular structure, it's a gland. In this case, the gland is the tonsil, and this is the palatine or the palatine tonsil because it's under the palate. This one was the nasopharyngeal tonsil because it's in the nasopharynx, also known as pharyngeal tonsil or adenoids. And that's what we can see in this large model here. Put this back here. So you can see it closed like this, showing the nasal septum, or open, so you can see what's inside, the conchae, and the conchae and the meatuses, or you can remove this, and you can see the fibers, the nasal fibers, going through the cribriform plate, olfactory bulb, olfactory tract, which is together olfactory nerve. And this is what we can see in this large model.